So today's lesson is for people, it's for you if you're approaching Medicare, the sign up of Medicare for the very first time, or if you've already faced that and you decided to delay. So if Medicare is in front of you and then you don't exactly know what to do and when to do it, that's what this thing's made for. So this year's version, I'm going to spend a little more time on this first set of decisions, which is, should I sign up for Medicare Part A? Should I sign up for B? Those aren't necessarily you're going to do at the same time, and why you'd want to do each one of them. Because if we don't get this first set of decisions right, then we're going to be messed up, okay? So the layout of today's presentation is there's really three sets of decisions that you need to make in regard to Medicare. And the first set of decisions is, do I sign up at 65 or do I delay? Okay. And then once you've made the decision to sign up, and that signing up is for both A and B, now we're going to move to the decision of, am I going to stay on original Medicare, which I've just signed up for, or am I going to go for one of these Medicare Advantage plans, which is Part C of Medicare? So that's going to be a binary decision where it's one way or the other. There's no in between. And then we need to get through those decisions. And then once we're there, then we're going to get to which insurance company am I going to buy my insurance from? And I think where people get in trouble with these decisions many times is they use as their main source of information the people like me that are insurance salespeople. And so we're going to start with the company. We're going to start with the third set of decisions. You know, which company to buy from? My company. And then we're going to work all this stuff backwards. And that's where people get not only confused, but they end up selecting the wrong product and the wrong decisions around all of this stuff. So we're going to do it, I think, in the right order. And we're going to start right out with the, do I sign up for Medicare now? And the main reason for delaying is going to be because you're working. You're still working. And this is the number one question that we get written into us constantly, or people ask us when they call us. You know, I'm really thinking about those penalties. Tell me about those penalties. I want to avoid the penalties. I'm still working. I'm going to continue working. I don't know how long, or my spouse is still working. I got group insurance. Should I sign up for A? Should I sign up for Medicare? Yes or no? And then when I say, well, it doesn't sound like you need to, then they say, well, I don't want any penalties. So what we're going to do is we're going to stay right here, and we're going to spend a little more time here right in the beginning, and then we get on with the second and the third set of decisions. So if you're still working and you have group insurance, the answer to that is probably no for getting Part B, and it's maybe get Part A now. Maybe not. So let's start with Part A. So like, why would I want to delay signing up for Part A of Medicare if I still am working and I have group insurance? Well, you're going to want to delay because, you're going to want to sign up for it now because it has no monthly cost. I mean, you've already paid for Part A of Medicare. You just get it because you're turning 65. The reason you would not want to sign up for it is if you're part of a health savings account under that group insurance, because there's a little known regulation that says you can't have Medicare and an HSA or add to an HSA at the same time. So if you're part of an HSA under your group insurance and you're going to go past 65, it's probably best if you don't sign up for Part A. Simple as that. But if you're not part of an HSA, you're going to continue your group insurance, you're going to get your insurance from someone else, go ahead and sign up for A, okay? But then now we're down to B. So With Part B, it's a little bit different of the decision because Part B in 2022 is going to cost you $170.10 a month. So that's over $2,000 a year you're going to have to kick out for Part B. And if you need Medicare, which probably most of you watching do, I say, you need to sign up for this Part B when you're turning 65 and just go ahead and work on it. But if you're still working or your spouse is still working and you have group insurance and it's all satisfactory to you, then you're probably going to want to delay the start of Part B until such time as you lose your group insurance. Now, how about the probably there? Well, and how about those penalties that I've read about for Part B? Well, the probably comes in there is if you're going to delay signing up for Part B, or in other words, not sign up for it now, rely on the group insurance, you're going to want to make sure that your group insurance, and I can help you do this, is what the Medicare calls creditable coverage. And so you're going to later need to prove to Medicare is since 65 till the time that you actually want Medicare and you need Medicare, you're going to need to prove during all this time where you're relying on group insurance that you had creditable coverage, which gets you a free pass against the penalties, and you can just go ahead and sign up right at the time you need it, maybe a year, 2, 3 years forward. And so creditable coverage, let's talk about that for a minute. It's basically group insurance from a company that has 20 or more full-time employees, from your own spouse, from you or your spouse's employer. So, that's the situation that I'm in. I'm 63 and a half. When I turn 65, my wife is still going to be like 63 and a half. And my group, we only have 11 employees here at Cardinal. So we don't fit into this deal. And so I'm going to have to sign up for Medicare Part A and Part B and buy a supplement. And I may need to keep my group insurance for a year just so I can cover my wife, who's not an employee of Cardinal. So I'm going to be in a little bit of a pickle. But we provide this kind of consulting, and I would recommend it to you if you're turning 65. You don't really want to try this at home. I can look through pretty quick and walk you through this thing. Sometimes it's the spouse. Sometimes we've got a person turning 65 and they're covered under their husband or wife's group insurance as a spouse, and this is optional to them. So we're going to just really need to talk through whether it's going to be a good idea for you to sign up for Medicare Part A and Medicare Part B. That's really the gist I wanted to get this. And I'm expecting this to cut down a little bit on the questions, should I sign up for Medicare now or not? And what about the penalties? Because the penalties are going to come in if you mess all this up. So if you don't sign up for A and B when you were supposed to because your coverage wasn't credible, or you were relying on the Veterans Plan or COBRA or something else, and you mistakenly went without Medicare, relied on some other insurance, and now it's a year or two later, and now you want to get on Medicare, and we discover that you're not only going to have trouble getting on it and some delays, but you're going to pay a penalty. And then once they assess a penalty, that penalty under Medicare is for the rest of your life. So these things are worthy of avoiding. Most of the time, we're able to get you out of these, in other words, just think our way through a solution. But I'd much rather talk to you in the beginning and help you through this, and then set up you as a potential client for later on when you do need Medicare. Then we can help you get signed up, and then we can sell you some kind of insurance to supplement it. Okay? So now we're going to move on to the decisions number 2 and number 3, which is the rest of the presentation. Okay? So decision number 2 boils down to this, is you're already signed up, you're on Medicare Part A, you're on Medicare Part B, you're all set up to pay your $170.10 a month, and more if you're a high income person and you're having to pay IRMA, maybe $200-300 a month. But original Medicare by itself is really not enough. Okay, it's just not. And so people have a need, and that's where the insurance companies come in. People have a need to either supplement it and then enroll in a Part D. So that's one route to go. Or what you're able to do is take your original Medicare and turn it into a Medicare Advantage by your election, or you're outsourcing Medicare, or Medicare's outsourcing you, is you're going to now receive your Medicare from a private insurance company, and this you're not really able to supplement it. So this works pretty well as just a standalone coverage. So there's some reasons you want to do this. There's some reasons you don't want to do this. You want to be a little beware. There's also some reasons you want to stay on original Medicare. You want to buy a supplement, and then you want to get a standalone Part D drug plan. So there's reasons, pluses and minuses both ways. But this is where I got into that second decision, and I'm saying it's an either or thing. Once you're on original Medicare, you're either going to stay there and supplement it with these two things, or you're going to take your original Medicare and receive it from a private insurance company under Part C. So that's a decision that you're going to need to make before we get down into which particular plan you're going to buy or which insurance company you're going to buy from. So this is an either or. And unfortunately, a lot of folks don't go over this that are selling it to you. They're just going to start you down this track, because that's what they're selling, is Medicare Advantage plans, or they're going to start you down the Medicare Supplement track, leaving you on original Medicare. You know, in other words, these people don't necessarily tell you about this alternative. And these people just start you here, and they don't tell you about this alternative. That's not true of everybody. And this is why people get so confused. And when I meet them, and they've already talked to a number of people, researched a lot of things, and they start asking questions, they take attributes of the original Medicare and the supplement, and they start applying them to a Medicare Advantage plan. Or in the reverse, they take attributes of the Medicare Advantage and they start applying it to all of this stuff, and a little bit of this, a little bit of that, and they're so confused, they don't know which end is up, and a lot of people just end up buying something to feel like they've done something, and, you know, it's not good. So let's talk about why you would want to do one or the other. I mean, the biggest reason people go the Medicare Advantage route of basically turning their original Medicare into a Medicare Advantage is the premium for many of these plans is zero. So in other words, the insurance company is going to take you on, and they're not going to charge you directly anything, because they're going to be paid from the government behind the scenes, and they don't have to charge anything. So a lot of folks, when money's real tight, they're going to go with these Medicare Advantage plans. And for that, for making this change, along with a zero premium, you're going to get extra benefits. You get dental, you get vision. Most of the time they throw in a Part D plan, so that's already coming with it. All of this stuff happens at zero premium and extra benefits. Well, what's not to love about that? This is the stuff that you see Joe Namath talking about on TV constantly, and Joe Montana, and all the Joes and the quarterbacks and all that kind of stuff. They're all they talk about is the extra benefits. You're going to get dental, you're going to get premium back, you get on a meal plan. Well, all that stuff is wonderful, And it is for many people. We offer these type of plans. So if you want to evaluate that, we offer most of them, but I don't have all the details of that up here because that'd take all day. We're in all 50 states in the District of Columbia. So if you're interested in evaluating that and getting at this, we're going to look at the cross-section of plans in your zip code, what's really available to you, and then we're going to look at it. And if you'd like, we're going to compare this option to staying on original Medicare and then supplementing it, and a bunch of options inside of there. So it's more of a personal thing when you get down to making this decision. I'm just explaining it to you generally. Now, why would you not want to do this? The biggest drawback to this Medicare Advantage business is the fact that you have to deal with networks and that you have a list of doctors that are approved on the plan, and you have to go to them for care, or you need to make sure who you're going to is on there. Same with hospitals. Now, that's not the end of the world, because many of you turning 65, you've been on group insurance, you've been on some kind of insurance that has a network, and you're used to that. And it's not like they're going to force a network on you, because we have a selection of many, many different companies offering Medicare Advantage plans. And so we can take your doctors and work backwards and find one that works for you. So I don't want to talk bad about these things. They're just a deterrent. And they don't necessarily travel well. So if you want to go for care, you want to go to the Mayo Clinic, or you wanted to go to the Cleveland Clinic, or Houston, for the cancer center. And when somebody gets seriously sick, they have a tendency to want to go see the best in the best research hospital. That's where all of a sudden you've planned a network around your local city. You might run into problems. Okay. So, and even for more minor things, this can add a certain element of hassle. So that's the deterrent, the network. The pluses is you get a bunch of extra stuff for zero premium, and you get all that without having a cost. It's good. Now let's go back and look at the other alternative. The other alternative is you stay on original Medicare, Part A and Part B, which is your doctor and outpatient. And if you just have that, you're going to face some fairly large deductibles under Part A, and under Part B, you've got an open-ended 20% essentially that you're paying. Medicare pays 80%, and you have open-ended. There's no cap on that. So if you had tens of thousands or hundreds of thousands of bills under Part B, you would be responsible for 20% of that open-ended, and that's a problem. And so this type of coverage calls for you to supplement it. And that's pretty easy to do these days. Let's talk about the supplements for a minute. Is we represent over 40 different insurance companies that offer these supplements. And the thing that's interesting is these companies all offer identical policies. So there's only 10 plans available for these insurance companies. The government designed the plans and they laid them out, and then the insurance companies pick which of those they offer. And the best of those plans available to people going on Medicare now is the G policy. So don't want to get into a bunch of details. There's 10 of them. The one with the letter G offers the most benefits. So we're going to only talk about that today. If you want to call me up and talk about some of the other options, we'll show them all to you. We represent them. But the important thing for you to get in this lesson is, like in your zip code, there's probably 40 different insurance companies offering 40 different Plan Gs at 40 different prices, and they're all identical in benefits. A G is a G is a G is a G, and it's a really good policy. It covers almost all the deductibles. There's only one deductible of $233 under Part B in 2022, which is the Part B deductible that's not covered by the G plan. The rest of it's covered. So if you go with original Medicare and you buy a Plan G Medicare supplement, you're going to be real happy with the insurance coverage you have. You also are going to have no networks, doctors and hospitals. You can go to any doctor in the United States, anywhere, that accepts Medicare. You're even going to have coverage if the doctor accepts Medicare, but they charge you excess charges, the Plan G actually picks up the excess charge or the balance bill. I mean, it's truly phenomenal coverage. It's plugging a lot of the holes in it. People that have this are real happy, but it's not necessarily cheap. So people who don't want to pay this Medicare supplement premium, we're back over here, okay? And like I said, this is not a bad alternative. This is like the luxury plan. And what I want to show you is the variances across the country. Now, the North Carolina price and the California price for Plan Gs are going to be what most of the country, somewhere between those two, and a lot of the country is going to be right around the North Carolina price. I use that because we're in Durham, North Carolina, and we have a lot of our customers locally. As I said, we have customers in all 50 states and DC, and we're taking calls from people all over the US, and most of the country is going to be at this price range. Now, so let's talk about that first. In North Carolina, the Aetna plan charges $111 a month for a male who's 65, who's single. Okay, so why did I pick a male, 65 and single? I'm making the price as high as it could be. If this was a female, this price would probably be $100 a month. I mean, or 103. So women are charged less in many states, or most states in North Carolina. And then if this male was living with another adult, so people that cohabitate in the same household, many times married, they collect, or in other words, they cost the insurance company less money, just statistically. So you get this thing called a household discount. So this would be down around $100 a month if this single male. So I tried to show you the highest it could be at a given age instead of the lowest, but it could be less than this. It also could be more than this if you're watching this video a year later, because this is the rate at the beginning of the year. Some of these insurance companies throughout the year could have a rate change for all new business. Now, the exact same G plan with AARP in North Carolina is $117 a month. Mutual of Omaha, $123. We represent all these companies, so there's not a huge difference here in prices, but there's some company charging $175 a month for this exact same thing. I just don't have them on the board. Now you go to California, this same Aetna is $191 a month, but you can buy the AARP plan for $133 or Cigna for $137. So this varies state to state who wins the pricing game. You get to Florida, they're in a much tighter band here. And Florida just has a lot of regulations, and they're more expensive. Florida is one of the more expensive states. You call in, you people from Florida, you could just talk to me, and it's pretty much across the companies in a tighter band. But you can save a little money by selecting one company over the other. And New York is the most expensive state, and actually the best deal there is through AARP, $278 a month. And we have many people in New York that go for this, and they go this route just because the best deal we can give them is still, over $3,000 a year for the supplemental coverage. Might lean some people more toward that. Then you have the folks who they don't want anything to do with this. They're willing to pay the money, and then there's some options to lower the coverage a bit or change it and get the premiums down. But I just wanted to show you a cross section that if you give us a call and you want to stay on original Medicare, you don't want to mess with networks, we're probably going to recommend the Plan G, and this gives you an idea of pricing for that. Now, if you stay on this route, you're going to need to buy a separate Part D plan, and the Part D plan is fairly inexpensive. Many times it's going to be closer to that $10 a month than it will be $40 a month or more. Just trying to give you a general idea of pricing, because behind the scenes, the government is paying the Part D drug company a lot of money to have you as a customer. So this is just a small piece of the cost, but you will incur this, but you'll also get the opportunity to pick from about 10 different plans. So we can plug your drugs in and figure out which Part D company is going to give you the best deal. Now, you don't get any dental on original Medicare, so you can buy standalone dental and vision from us. Okay, now I want to move on with the subject to the next question is, who do you buy it from? These same companies offer Medicare Advantage. So these 5 companies are the biggies in the Medicare supplement business. They're also the biggies in the Medicare Advantage plans, and there's more than just these. So once you've picked the route you want to go, now we're going to get into what company do you want to buy it from and which plan do you want to get. And I kind of did that for you in the Medicare supplement and walked you around. It's really very hard to do that on a video on the Part C, but we'll go through. You get us on the phone, or we can do a Zoom, however you want to do it. We can trade some emails where we can show you some options under this if this zero premium and the extra benefits is attractive to you. Okay, and that's about all I'm going to say about picking a company. We're pretty neutral on that. We'd like you to become a customer of us, but we don't really care which company that is with, because we represent most of them, like I said. Now, I want to talk about Social Security sign-up, because that's facing people turning 65 as well. And you do a lot of research on that. Just a couple of simple things is there's still people that believe that Social Security starts at 65 or should start at 65. And it can start at 65, but you're going to get a smaller benefit. Some of you started it back at 62, and you already know that you got a smaller benefit, but you've already collected a couple years of checks. And I mean, it's purely your option. You probably are not still working, because it doesn't work very well to start your Social Security early or before full retirement age, collect your Social Security and still have money from a job. That doesn't work real well. But we're financial planners. I'm a CFP, and we assist people with this whole Social Security business. I've got other YouTube videos, but I want to make a point is the people born in 1957, your full retirement age is 66 and 6 months. And you ask, why is it some odd amount? Well, it's because there's a phase in. It's working its way to 67. We're just not quite there yet. So for you, full retirement age is 66 and 6 months. And what that means is you can start getting your Social Security check at 66 and 6 months. You'll get the full Social Security check, and you can keep working. So if you make other income past full retirement age or past other service income, collecting your Social Security check past, that doesn't really create problems or an additional tax. For those of you born in 1958, which is the year I was born, vintage year, of course, 66 and 8 months. This is the first time I'm making one of these Medicare videos where I'm actually talking about myself. But for those people born in 1958, our full retirement age is 66 and 8 months. Now, many of you are going to delay as long as 70. That's what I'm going to do, and I plan to keep working. You're going to get a much larger check, but you will do without checks for 3 years plus. So we can help you with Social Security decisions. And one of the reasons I'm bringing it up, because many of you are turning 65 or approaching that, this decision is still in front of you. I also want to let you know that you're going to be going to Social Security to get Medicare. You go to the Social Security Administration to sign up for Medicare. And if you're already getting Social Security check, they're just going to mail you a card. You don't even need to sign up for all this business. In fact, if you don't want it when you turn 65, you're already getting you're going to have to unsign yourself up. I can help you do that too. Now, and we just make mention that if you also have the option of applying for Social Security under your spouse's benefit. Even if your spouse is deceased, that's going to be an even larger benefit from that. And you can just come in and talk to us about that. Sometimes people can get more from Social Security by applying as a spouse. Okay, a couple more things I wanted to talk about. People turning 65, you know, if you have money in a 401k and you've mainly been concerned and worked on the investment of that and contributing to that and watched your balance grow, now you have the problem facing retirement of what are you going to do with that? And it's not so much what are you going to do with the investment of that, how are you going to live off of that? Or do you need to live off of it? And do you want to roll that over into an IRA? And then do you want to create an income from that? What about taxes? How does that affect your Social Security? This is a big area that we help people. We have areas of Roth conversions. There's a whole bunch of stuff around that, but if you have this hunk of money, you're approaching retirement, it's probably something you're going to want to get some help with. And you can do that here at Cardinal. We also are in the life insurance business, and generally people in retirement, some people don't feel like they need any life insurance, and you're not going to hear much argument out of us, but many folks see the need for either a smaller amount of life insurance just so there'll be something there in a life insurance payment to settle their final expenses. There's many people that start thinking about their estate, and now it calls for a larger amount of life insurance, and we're consultants and can help people with that. And then the long-term care question, that's something that if you haven't already planned for that, we ought to take a look at it. So we're not going to cloud a Medicare discussion or Medicare decisions with all of this extra stuff. But if you call into us and we do your Medicare consulting, we're available to help you with all this other stuff too. So I'm Hans Scheil, and I thank you very much for listening.